Hey everybody, welcome to the Dr. Mom Show. It's Dr. D, mom of three. Hope you guys are having a good week, and even more so, happy November. So we're down to the last 2 months of this year, 2019. So you better start getting your short-term goals fulfilled, and you better start making your list for your long-term goals that you want to get completed in the year of 2020. So first of all, I just want to remind you that the Dr. Mom Show is a medical informational resource. It does not take the place of your physician or your child's physician. So definitely seek medical advice from your physician or your child's physician. Before we get into our topic today, again, I just want to remind you the holidays are coming up. Yay! I love the holidays. I love this time of the year. Little hectic, but it's great and tons of fun. So I just want to remind you to get those gifts checked off on your list. So first, don't forget I have my Mom Devotional, MOM, Meditate, Overcome, Motivate, a great 30-day devotional and workbook for any woman in your life, whether that's your wife, your own mother, your mother-in-law, sister, anything, cousin, whoever you want to give it to. Is just a daily affirmation and encouragement with a prayer and a scripture, with just a challenge for the day to make sure that what you're reading you're implementing into your own life, and how you can implement it and impact other women and other people around you in general. Then of course we have the Tripsies and me, so definitely get yourself a copy. Again, with the holidays coming up, what better gift to get your child or your grandchild or niece or nephew is a book, because a lot of times people don't even know how to read. It has fantastic illustrations in there, and it's a beautiful book that rhymes. So easy words. It's gauged for ages 2 to 12. So definitely check that out. And also note that you can get both of those books on my website, www.delimushalak.com. And then, of course, recently, as you know, I went to the conference and was nominated Author of the Year by Miss CEO. So I'm super excited to share this book with you. It is called Miss CEO Finale, Ain't No Plan B. Yours truly, I am one of the authors in there, and it is such a great book because there's multiple authors in there. Each one of those women, including myself, is an entrepreneur, and pretty much we speak about a challenge in our life, because a lot of times people look at entrepreneurs and they say, oh, they're successful or they're doing all of that, and they don't have any issues or any challenges and everything's success for them. But that's not how it is. And a lot of times being an entrepreneur is very lonely, and it's hard to attain those high goals because not a lot of people have very high goals. So my chapter is called Overcoming the Mountain of a Mompreneur. So definitely check that out. If you want that, that's not on my website yet, but you can definitely message me or comment. You can send me an email to drmomshow@gmail.com if you'd like a copy. So definitely check that out. Well, today we're going to get right into our topic. Our topic today is based on November. Every month we have an awareness, multiple awarenesses really, and this month in November is National Impotence Awareness Month, or otherwise known as erectile dysfunction. And a couple of reasons why I'm talking about this one, because I know a lot of women watch my show, but I also want to gear information for men too. I want to reach that population, because I tell you what, as a physician, guys are one of the hardest populations to get information from. Most of the guys who probably get seen, either their wife forces them to come and see you, and a lot of times with guys, they don't even give you the whole story behind it. So definitely getting information for men is a little harder, but definitely I just want to encourage, if you're a wife or even if you're a guy watching this, that whenever you see your physician, that you definitely just want to be honest and open, and if you have any questions, to definitely discuss that with your doctor. So again today, so as far as impotence and erectile dysfunction, what is that? So pretty much that's when a man has difficulties either obtaining, so getting an erection, and then sustaining, so keeping an erection. So it can be either one of those, and pretty much ultimately as impotence or erectile dysfunction progresses, Guys can't get an erection even when they attempt to be sexually aroused, and same thing, they can't keep an erection, and sometimes they aren't able to ejaculate because, again, you can't even get or keep an erection. Now, erectile dysfunction itself becomes increasingly more common as men age. However, there are some underlying disorders that can cause erectile dysfunction sooner in life, or even cause it to progress faster, or just cause it to progress altogether. So this is why, and one reason I'm talking about is because a couple weeks ago I talked about diabetes, and we know that diabetes can affect the blood vessels, and erectile dysfunction is one of the things that diabetes can cause, and it can be a complication of diabetes. So I just want patients and people out there to be diligent and mindful about this. So pretty much some causes of erectile dysfunction are due to either nervous issues, if there's any issues with the nerve endings, then, as I mentioned, the blood vessels, so the blood flow. So those are probably two of the main underlying reasons. And then, of course, there's things like hormones. So normally when you go and a patient is having erectile dysfunction, let's say it's somebody who's healthy, we usually do check testosterone levels, because a low testosterone level, and again, as men age, we can see that testosterone level go down. Now, testosterone itself has a pretty wide range of what's called a normal range, so it kind of depends on the symptoms that a male patient is having. So hormones is one thing. Then, of course, there are important questions like, are you having a morning erection? Because that also helps us out a lot. So, like I said, testosterone. Then things that affect your nervous system. So again, like we know, diabetes can affect the nerves. Alcohol drinking can affect the nerves. So definitely watch out for that. We do see patients who have been alcoholic or drink more than they should be drinking, or what is advised, and they have issues with getting or sustaining erections. And then, of course, blood vessels. So, of course, if there's any blockage or decreased blood flow, so again, diabetes, high blood pressure, smoking. Sometimes in smokers, we can see that the tips of their fingers can start getting blue, and not when it's cold, but again, it's just because their blood isn't flowing like it should be. High cholesterol. So those are all things that can affect the blood flow, and then ultimately affect a male getting and sustaining an erection. So as you can see, it's very important to, one, be honest with the symptoms that you're having, and then number two, to understand if you have a diagnosis of any of the things I've spoken about: diabetes, high blood pressure, tobacco use, drinking too much alcohol, that you can see the potential complications that can come out from that. And for all of those things, erectile dysfunction isn't the only complication, it's just one of the many complications that can happen. So, of course, like with anything else, the sooner we can diagnose an issue or a problem, the better, the faster we can attempt to treat it. Now, of course, with some of these, you have to treat the underlying reason. So, of course, if testosterone is low, we would want to replace that. If you have diabetes, we want your diabetes to be under control. If you have high blood pressure, we want your blood pressure to be controlled. If you're drinking alcohol too much, we want you to decrease that intake. If you're smoking, we will want you to decrease how much you smoke and ultimately quit. So as you can see, there is a domino effect in what you do and how it results in potential complications of your body. So with this, I just want to encourage you to, again, be honest with your physician. If you are having issues with obtaining an erection and sustaining one, definitely get it checked out to make sure that there isn't another reason, because sometimes we'll get patients who present with this issue and they aren't diagnosed with anything such as diabetes or alcohol intake or high blood pressure, but when they present with these issues, it helps us to work up underlying causes that could potentially be the reason for that erectile dysfunction. So I hope you guys have learned a lot. Don't forget to kiss your kids, love your family, wash your hands, and say your prayers good night. All right, we'll see ya. Bye-bye.